Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
LGBTQ.
Q, yeah, throw that in there.
Most people know what the letters stand for. Well, except for maybe Q. I read the other day that it can stand for queer or questioning. But what do the terms really mean, and why are there so many? And do all those terms replace what used to be called the gay community? And I have to tell you, when I was in medical school, it's a while ago, none of these terms did we learn about.
That's true.
I'm so happy we're doing a program on it.
Yes, well, for the layperson, and even for some people, whether retired or not, in the medical profession, all of those terms can be a little bit confusing. So here to help us sort it all out is an expert from the Division of Women's Health at Mayo Clinic in Arizona, Dr. Jewel Kling. She joined us by telephone. Welcome back to the program, Dr. Kling.
Yeah, thank you so much for having me.
All right, Dr. Kling, let's start from the top. LGBTQ. Can you explain those terms? How do you explain them to the uninitiated, like myself, actually?
Yeah, absolutely. And before I do that, I'd just like to start by saying that I use she and her pronouns and consider myself cisgendered, and I identify as heterosexual. So I am an ally to the LGBT community, and as such, help co-chair our employee resource group here at Mayo. And so get the opportunity to talk to a lot of people about what the letters mean. And probably it's easiest just to start by defining them. So the L is lesbian, the G is gay, the B is bisexual, the T is transgender, and the queer, as you already discussed, or the Q, as you discussed, can be queer or questioning. And in our employee resource group, we also use the letter I, which is intersex, which represents people that are born with a disorder of sexual development.
Now, Dr. Shives, I love this little turn we're going to do here because quite often, well, always when we have medical guests on, you will break down some of the medical talk that some of the guests might do. Mm-hmm. I'm going to ask you now to break down what you said when you introduced yourself. The pronouns that you use, I think we all understand, but you said that you are cisgender. Yep. So explain a little bit about what you said at the beginning.
Yeah, so cisgender would be the idea that I identify as female, which is the sex I was born or assigned at birth. So when I was born, the doctor said, hey, you have a healthy baby girl, and I identify as female. So that means that my gender that I identify as is the same as the sex I was assigned at birth, which is opposite from transgender people, where there's a discrepancy between the sex assigned at birth and the gender that they identify as.
I think the term assigned at birth is a big part of where the confusion begins, because what people would say is, well, if you had a penis, you're male. If you didn't have a penis, you were female, and that's how we identified babies. Mm-hmm. But that's not necessarily true.
Yeah, you make a good point, and that really pulls in that intersex or the disorder of sex development. So there are conditions that babies are born with genitalia that don't represent the genetics or the genes that are consistent with that sex. So we think of XX as being female, but sometimes you can be born with XX and have a penis or genitalia that looks male. And so that kind of puts that whole what you look like on the outside is the same as in the inside into question, both from a biologic perspective, but then also kind of lays the groundwork for this idea of being transgender, and really gets to the point that gender is made up of multiple things. And many of us are taught or think of gender as just a binary, either you're male or you're female. But in fact, it's better to think of it as a spectrum that includes gender identity, which is how you feel, gender expression, what you wear or what you look like, and then biology.
I think using more feminine versus more masculine gives you that idea of a spectrum.
Sure, yeah. And then you could kind of put people in those categories. Like an example I will commonly share with people when I'm presenting on this is that although I'm cisgendered and I identify as female, when I was growing up with two younger brothers, I was a tomboy, and I dressed in big baggy shorts and big T-shirts, and so people would mistake me as male often. So that dichotomy between kind of your gender identity and expression.
You know, I have difficulty understanding gender identity because let's say that you're born with male genitalia, but people like that who are in a different category feel like a female? And what's it like to feel like a female? I mean, how do you know whether your feelings are male or female?
Let me tell you about it, Dr. Shives.
Help me.
Okay.
Well, it's a great question. I don't know if I have an answer, especially not being somebody who's transgender. I can't necessarily speak to that, and I think scientifically or medically we don't have the specifics, but that is what we call gender dysphoria. That's the diagnosis that we use, where people are born with genitalia like you're talking about, like a penis, but feel female. And as I've talked to more transgender people, they just know. They know from a young age, like this body doesn't fit with the identity that I feel. And then the goal of treatment is really to help alleviate that dysphoria. So whether that's just expression, where they can dress the gender that they feel they are, or for many transgender people that includes hormones, which help with the transition. And then for some, it's surgery, either top or bottom surgery, to help their body be more congruent with the sex they identify as.
But that's quite a ways down the line, isn't it? Something as radical, I guess, as surgery. From other interviews that we've done, it would seem that mostly these folks want to just be accepted as they are.
I think that's probably a fair statement. I think some of the question about surgical interventions or bottom surgery, for example, has to do with access to medical care and insurance coverage. So if you look at the percentages of transgender people that actually undergo surgeries, it's pretty low. But as more insurance companies start to cover those procedures, more and more transgender people are choosing to undergo surgery.
Well, go ahead.
So really the reason that there are not more surgical procedures done is because of insurance reasons, you presume?
I think that's probably a big thing. There may be access issues, and one of the issues that transgender people have faced for so long is stigma and discrimination, especially from the healthcare field. And so that's something that they have to overcome, and something that we're working with our staff to make sure we're an inclusive environment.
That's the next question I was going to ask. Why is it important for organizations like Mayo Clinic, healthcare organizations, to be in touch and that this is on their radar?
One of the things we talk about at Mayo is that diversity is really important to us, and we want to provide a space that's inclusive and kind of comprehensive for everybody, including transgender people. They've historically had experiences where they'll anticipate either being turned away overtly or being overtly discriminated upon by the healthcare team. And so we want to make sure that from the get-go, when you call in to schedule, that somebody's not assuming you're a certain sex based on something that you say, but having a two-step identification process where you ask what's your sex assigned at birth and what's your gender identity. Having clues around the office, visual clues that make sure that our transgender patients know that they're in a safe environment.
Do you think there have always been transgender people?
Yes.
Because, we never heard the term for decades when I was growing up.
Well, one of the things we talk about in our cultural competence is the rate of transgender people, because a lot of people are like, well, why do I have to learn about it? It's just a small percentage of people. I'm never going to see a transgender person. But it turns out, as of 2016, this self-identified population study found that 0.58% of the U.S. population, or approximately 1.4 million people, identify as transgender. To give a perspective, there's 1.2 million type 1 diabetics in the United States.
Wow.
And most people know what a type 1 diabetic is, or know a type 1 diabetic. And so the population is greater than one would assume, and I suspect, as you're getting at, the more we talk about it, the more people that experience gender dysphoria or transgender will feel like they can come forward and pursue being the gender that they identify as. And
we've talked about the rate of suicide is highest in the transgender population because they don't feel like they're accepted anywhere.
The rates of attempted suicide among transgender adolescents, alarming.
It's,
Right?
Yeah.
And
Is it in the 40% range?
Yeah.
Yeah.
It's shocking and heartbreaking. That's compared to like 2.4% in the general population. And an important point there is when we talk about health disparities in the transgender population, to recognize that those disparities are mediated by social stigma and discrimination and are not inherent to being transgender. So just because you're transgender doesn't make you more likely to be depressed or attempt suicide. It's all the other things that you're dealing with from society and access to healthcare, all those type of aspects.
All right, thanks so much. Dr. Jewel Kling is an expert on women's health and gender identity. I think I know a little bit more than I did before, but,
I hope so.
But it's a fairly complex subject, and hopefully, Dr. Kling, you'll join us again and for further discussion on this topic.
I'd love to. Thank you so much for covering this.
Thanks for joining us, Dr. Kling.